Hello, everyone. Welcome to today's workshop. My name is Naisha, and I'm the program manager here with the Holding Space Foundation. And we're super excited to get started with our workshop. And of course, I want to introduce you to our speaker of the of the afternoon. So, Chanel Reed is a second year dendrochronology student at the Dendrochronology Institute of GSU, Georgia State University. She has immersed herself in research at the GSU Hope Lab, focusing on understanding the ramifications of social isolation, loneliness, and heightened suicidality among vulnerable populations. Her interest in this field was ignited during her enrollment in the Death, Dying, and Loss course. Chanel's dedication to suicide prevention extends beyond her academic pursuits. Last year, she became a part of the American Foundation for Suicide Prevention as an advocacy volunteer and now serves on the Prevention Education Committee. Her involvement has led to the organization of various community events and webinars, including the Talk Saves Lives series, which aims to raise awareness, provide education, and foster dialogue surrounding suicide across multiple communities. And that's exactly what we're doing today. And Chanel, I am going to pass it over to you.
Well, good evening, everyone. Thank you, Naisha, for that wonderful bio. Again, I am Chanel Reed, and I am connected to the Georgia chapter of American Foundation for Suicide Prevention. So let me get ready to share my screen. I'll tell you a little bit about why I'm here. That bio actually explains, but for me, it was almost personal because being in some of these spaces, like last year, I went to the suicide prevention seminar. And often I'm the only person in the space that's actually raising the alarm, not only for our older adults, but for African Americans. So this is a space that's much needed. So I am definitely happy to be here because I do know it's definitely impacting our communities at great rates. And we need to talk about it. So I'm here to provide some information and just to plant that seed, if you will, about African Americans and Black communities about suicide prevention and what we can all do. So I thank you all for being here because we're all part of the process and we're moving together to actually make sure we keep us and our communities safe. So I'm going to just go ahead and do the slides here. This is just our disclaimer. So before we begin, we just want to clarify that this presentation is just intended for a general audience and that this presentation is meant for educational purposes. It's not a substitute for professional mental health services. So if you feel like you'll need more information about professional services, we're going to have some resources at the end of the slide, this presentation, and you can use those. I just want to let you know that, but I definitely thank you for being here today. So what is AFSP? So our mission is to save lives and to bring hope to those affected by suicide. We create a culture that's smart about mental health by engaging in the following core strategies that you see here on the screen. So funding scientific research, educating the public about mental health, suicide prevention, and suicide loss, advocating for public policies in mental health and suicide prevention. Finally, supporting survivors of suicide loss and those affected by suicide. And just for more information, you're welcome to visit our website at www.afsp.org. So today's learning objectives. After this presentation, you will be able to understand the scope of suicide among Black and African American populations, understand the racial and systemic factors that impact suicide in Black and African American communities, describe suicide risk and protective factors for Black and African American communities, describe warning signs of suicide, learn how to get help for someone who's in a suicidal crisis, and finally gain confidence in talking to someone about suicide because it's definitely a difficult topic. So who we are, we take our identity everywhere we go in this walk of life. So we're going to be doing a variety of activities in this particular presentation. So please follow along with us. So before we get into the presentation, it's important to recognize that we take us wherever we go. It's an important part of who we are, and culture can be shared in different ways. We want to invite our culture into this space as well as feeling whole when we're present in this room. So, just for the first activity, I would love for you to think about it. And if you're comfortable, please give me 3 words that describe you, and you can put them in the chat. I'll give you a brief example. Like, my name is Chanel, and I'll describe the 3 words to describe me that I'm thinking about off the top of my head. I can say sister, daughter, and advocate. If you feel comfortable, I would love for you to share with me the 3 words that you'll use to describe yourself. Anybody brave enough out there to tell us how you see yourself in 3 words? Oh, I love it. Okay, mother, wife, and maternal health advocate. I love it. Vivacious, fun, and mother. Oh, I love it. I love it. I love it. Okay, well, as you're thinking about it, I will just go ahead and move on. But thank you for the courage to share it, and thank you for everybody thinking about it. So we'll go on and go ahead and go into the presentation. Okay. So before we get started, I like to acknowledge that mental health and suicide can be a sensitive topic to talk about. And for some of you, this might be the first time you're talking about this topic, but talking about suicide is vital to its prevention. And we are grateful that you have joined us for this important conversation. But please know you don't have to be an expert on suicide to be part of this presentation. Our goal is to normalize conversations on the topic, so we'll work together to save lives. So before we get started with the information, we want to let you know that you and your well-being comes first. But please give yourself permission to take care of yourself while listening to this presentation. If at any point during today's presentation you feel the need to step out or just move away from your computer, please feel free to do so. We know this topic can be difficult to talk about. There may be times during the presentation where you have an emotional response, but again, please give yourself permission to acknowledge your emotions, to feel, to breathe, and take a quick break if you need to do so. So Black and African American individuals experience life differently from others, and I can believe that this can be stated for all individuals who are stated as identified as being part of a minoritized group. The stigma surrounding mental health and suicide in the Black community is very relevant and very real, and impacts how Black individuals across all ages understand these specific topics. So in a moment, we will discuss some things that we've heard about others within the community about mental health. They may add to the stigma and shame that surround these issues and topics. Not only do we have a stigma present, but we also have a mistrust of the medical field for good reasons. Unfortunately, there's a long history of Black individuals being abused by the medical field, and this has caused a great deal of pain and suffering. But not only that, fear the pain and suffering experienced will be minimized and untreated. Fear will be treated with disrespect and disregard. Fear that we won't be believed or our thoughts and our families won't be considered. These experiences our friends and our family members have made us mistrust the very system we are supposed to get treatment from. So looking at this slide, if you feel comfortable sharing in the chat, what are some of the things you've heard about mental health growing up in the Black community? And I'll just read a couple of things that's on the slide. Black people must be resilient. Having mental health problems means you're weak. Depression is a white problem. Black people don't therapy. I've experienced similar struggles, so you should be able to handle it. And if you don't get better, you can always find a way on your own and pray it away. So what are some things that you've heard about mental health growing up in the Black community? Oh, I love that. You don't need a therapist, go to church. I've heard, our ancestors face less. Actually, my uncle just said that last night. So, prayers to answer depression is of the devil. So, yes, we've heard various of things. Now, these are all things we've heard from our community. However, the stigma that surrounds these topics may cause more harm than good. I love Naisha said you don't need those pills, speaking from antidepressants. So, yes, just various of things that are not necessarily helpful. But yet still I rise. So we're going to do another activity, but I'm going to read the bullet points on this slide first. So these are some of the things that can help us from a Black cultural strength, the resistant and resilient standpoint. The strength of previous generations gives Black people strength to face the oppression of today. Black communities have led social movements to fight injustice and systemic racism. Traditions of alternative health practice have helped communities with limited access to medical care. The core value of being strong together can help individuals who experience mental health concerns. And finally, traditional health values, beliefs, and practices have aided in survival of Black people throughout hundreds of years of oppression, slavery, and colonial rule. So, given the things on this slide, the question is, how have you used the strength of your ancestors to survive in your life today? And how have you seen this strength in others? So if you're comfortable, please share in the chat. But I would love to know how you've used the strengths on this slide to actually do that. To be strong. Yeah, as I say, be strong. That's one of the myths. But how can we use some of the things that we have heard to make sure that we stay safe? I mean, praying is a good thing. I use meditation. Does anybody want to share how they rise despite the various of adversities that we experience? And the question of Naisha, how going to therapy and meditation, yes, some people use nature, singing and music. Yes, music is definitely wonderful. Nature is wonderful. So these are all wonderful, great examples on how we can still hope and thrive despite what's going through. And I love writing. That's wonderful. Thank you for the courage to share. So understanding suicide, suicide is a significant issue that affects individuals, families, and communities worldwide. So let's start with some situations that show how suicide impacts communities at different levels. So, how we talk about suicide matters. When talking about someone who died, we avoid using the phrases committed suicide because we don't want to suggest that suicide is a crime. Instead, we want to encourage the phrases like died by suicide or ended their life. When we're talking about suicide and suicide attempts, we want to avoid referring to the suicide attempts as failed or successful. These words imply judgment, and we don't want people to associate failure or success with suicide. Instead, we want to encourage the use of phrases such as suicide attempt or death by suicide. So when someone's talking about how someone's died, we want to avoid explaining the method that they used to end their life. If mentioned, please be brief and avoid including details, since graphic descriptions can be activating for those who struggle and cause contagion. Talking about suicide in this way can make it easier for us to have conversations about mental health with family and friends. So someone you know may be more likely to come to you for help if they feel safe talking to you about their suicidal thoughts. We want to change our community values and views on suicide because stigma can prevent people from asking for help. So, suicide is a complex public health issue, yet, despite its complexity, suicide can be prevented. Just like there are warning signs and risk factors for other health crises like heart attacks and diabetes, we can learn the warning signs and risk factors that help us to prevent people from dying by suicide. It is important to note that suicides can be and very often are preventable, but if a suicide loss occurs, it does not mean that you should have been able to prevent it. So in the US, suicide is one of the leading causes of death, impacting individuals, families, and communities. According to the Center for Disease Control and Prevention, or better known as the CDC, 48,183 people died by suicide in 2021. This is the most recent data for this particular presentation. This makes suicide the 11th leading cause of death across all demographics when we relate to and think about race, sex, and age. In 2021, which is the most recent data that we have, the number of Black individuals who have died by suicide equated to about 10 deaths per day. For Black youth, ages from 10 to 19 years old, it is the third leading cause of death. So Black adults living below the poverty line are more than twice as likely to report serious psychological distress than those with more financial security. Additionally, members of the Black community face structural racism, leading to barriers to access for care and treatment that they need. Only 1 in 3 Black adults who need mental health care actually receive it. From 2011 to 2020, the age group with the highest rates of suicide in the Black community were the ages between 25 and 34. Suicide rate for Black men is 4.5 times higher than the rate for Black women, even though Black women do suffer. The suicide rate among Black youth has been found to be increasing, similar to other racial ethnic groups of color. Suicide is one of the leading causes of death for Black females and males for the ages of 10 to 24. So the National Youth Risk Behavior Survey monitors health risk factors that contribute to the leading causes of death, disability, and social problems among youth and adults in the United States. It is conducted every 2 years during the spring semester and surveys age groups of the 9th to 12th graders in public and private schools throughout the United States. According to this survey, Black teens experience high rates of suicides, attempts, and planning. So based on the data from 2011 to 2021, Black students were more likely than Asian, Hispanics, and white students to attempt suicide. The percentage of Black and white students who attempted suicide increased from 2011 to 2021. So here are the statistics. More than 1 in 10 Black youth attempt suicide in the past year. Nearly 2 in 10 make a suicide plan. Nearly 4 out of 10 say they feel hopeless. So later in the presentation, we'll discuss life stressors and other experiences that may increase risk for mental health conditions and suicide. So what do we know about suicide? Now that we have a general understanding about how suicide impacts communities, we're going to look at understanding what contributes to suicidal behavior while taking a closer look into suicide and how this relates to the Black community. Suicide impacts individuals and communities. So there's no single cause for suicide. Suicide often occurs when multiple risk factors come together. For example, stressful experiences or losses can increase risk. when they occur on top of other risk factors, such as biological, psychological, genetic, early childhood, or experiences related to discrimination. When someone is in a suicidal crisis, they have limited access to usual coping mechanisms. By talking about this, it can help people understand the reason they can't think of any other way to stop the pain and how it may be difficult to have a conversation or do what they normally do to cope. So, most people are conflicted or ambivalent about wanting to die. Most people, that's how they feel. Part of them wants to live and part of them wants to die. They may think that if they weren't around, it would be better for their family and friends. They may feel like a burden. They may have a hard time seeing how they contribute to the community and or society. So a person who considers suicide has several things that causes them to think that way. They may be at a crisis point, often caused by a stressful event or several events that happen in a short period of time. The pain they're experiencing, it could be either physical or emotional, feels unbearable, or they never feel relief. Combination of stress and overwhelming pain may make it difficult for them to think clearly and have a hard time seeing their situation from a bigger picture or from an outsider's perspective. So, understanding the perspective of the person with thoughts of suicide has also helped us to learn that these feelings are often temporary. They can come on intensely and sometimes cause and pass in minutes or hours. So, keeping people safe and helping them feel supported can get them through those critical moments. So, who is at risk? So, these risk factors can come together at different times in life and increase a person's risk for suicidal behavior. So, risk factors are important to understand when considering what contributes to someone thinking about suicide. Just like someone who might be at risk for heart disease because of high blood pressure or a history of heart disease in the family, some people are at higher risk for suicide than others. So we group these risk factors into three groups: health, environmental, and historical. These risk factors can come together at different times in life and increase a person's risk for suicidal behavior. The first one is going to be biological factors. Mental health can be made worse by serious or chronic physical conditions. Think of long-term health concerns like diabetes, heart disease, high blood pressure, or chronic pain can also add to a person's suicidal risk when several other risk factors we're going over today in today's presentation, especially when mental health conditions are part of their life. What we see on the screen, serious or chronic health conditions, chronic pain, and serious head injuries can all contribute to causes. The next factor is going to be psychological factors. Having one or more mental health conditions is a serious contributor, but never the only risk factor in or of itself without other risk factors. So the most frequent mental health conditions that may elevate suicide risk are clinical depression, bipolar, which could be depressed or mental or mixed episode, psychosis, borderline personal disorder, got eating disorders and substance abuse. And anxiety often accompanies these disorders. The reason why it is important for us to talk about mental health and mental health conditions is that the large majority of people who die by suicide have a mental health condition at the time of their death. So we have to know that these two terms should not be used interchangeably. They are different, but certainly related. It may or may not have been recognized by the person or their loved ones. So if you or someone you know is experiencing a mental health condition, you are not alone. While there are many people in the community who experience mental health conditions, What is encouraging is that most of them do not go on to die by suicide. It is a combination of having a mental health condition and the presence of potential contributors in life stressors that make someone consider taking their life. In other words, if you or a loved one is diagnosed with and or getting treatment for a mental health condition, this does not mean they're certain to attempt or die by suicide. So we're going to do another activity. Mental health and physical conditions can play an important roles on the path to suicide risk. So the next question that I would love to ask is, what type of health concerns do we often see in the Black community? For instance, we know about the diabetes, cancers, high blood pressure. What others can you think about that we struggle as a community having? I love that obesity, diabetes, depression, heart disease, um, lots of that. So all of these factors can play a role in thoughts of suicide. Yes, stroke, lung cancer, a lot of chronic issues plague our community. So that can play a role in how people feel about their lives and just their contribution. So thank you for the courage to share. So the next factors we're going to talk about is the social and environmental factors. The ones you see listed here refer to the circumstances of a person's life or the aspects of a person's environment that can contribute to their overall level of risk. So we talk about access to lethal means or having a way to kill yourself is an environmental factor that contributes to someone's level of suicide risk. Suicide contagion, exposure to another person's suicide, or the graphic or sensationalization stories of suicide, particularly for individuals who have suicide factors such as depression and or past trauma. And finally, the stressful life events. They can include the death of a loved one, loss of job, divorce and separation, unsuspected illness, or injury. So while environmental factors do not lead to suicide on their own, when an individual has other health or historical risk factors, these environmental stressors can contribute to an escalation in risk. So although not unique to African Americans, perceived racism and discrimination have been found to be associated with depression, increased substance use, and hopelessness among African American youth. These factors, in turn, are associated with adolescent suicidal behaviors. However, upon experiencing the barriers to success, such as discrimination and institutional racism, they become frustrated, distressed, and at greater risk for suicide. Moreover, some have suggested that middle income African Americans may be also at risk for suicide because they experience anxiety, stress, or anger due to conflicts over pressures to adopt the values of white individuals while actually trying to hold on to their cultural identity and cultural experiences at the same time. All of these stressors and more can lead to suicide ideation. And finally, we have historical factors. Historical factors are often things that may be difficult to talk about as they may be personal to family history, and they can also include a history of suicide, a family history of mental health conditions, and past trauma such as incarceration, slavery, unsafe neighborhoods, and oppression. Recent research has shown that adverse childhood experiences, also known as ACEs, are events in childhood that can contribute to suicidal risk. They are events that can increase the likelihood of difficulties later in life. So, adverse childhood experiences, ACEs, they occur in a child's life as a result of extreme stressful, frequent, or prolonged body stress response. And a few examples of ACEs include experiencing violence, abuse, or neglect, witnessing violence in the home or community, having a family member attempt or die by suicide. And they can also include aspects of a childhood's environment that can undermine their sense of safety, stability, and bonding, such as growing up in a household with substance use issues, mental health problems. Also, the instability due to parental separation or household members being in jail or prison. So, all of these things can actually combine to include or increase the thoughts of suicide. ACEs in the Black community. So ACEs do not impact all communities the same. 3 in 5 experience at least one ACE, putting them most at risk out of any other group. Across all racial, ethnic groups, economic hardships, and let's start again. Across all ethnic and racial groups, economic hardship and the divorce or separation of a parent are the most common ACEs. And for Black children, parental incarceration is the most common ACE. So we have to keep all of this in mind that things that we experience in our childhood, they have a way of staying with us. So this can contribute to thoughts of suicide. And what does all of this mean when we're talking about ACEs? ACEs can have a lasting negative impact on health, well-being, as well as life opportunities such as education and job potential. Toxic stress from ACEs can change brain development and impact how the body responds to stress. The ACEs are linked to chronic health problems, mental health conditions, and substance misuse in adulthood. So, we're at a point now where we can have a break. So we can have a break for 5 to 10, 15 minutes, or I can keep on going. It depends upon what you think. So just in the consensus of the chat, do you need a break, a break 5-minute break, or would you like for me to continue the presentation? Because the next present part, so we're going to be talking about prevention. So be a consensus of the chat. Do you need a break, or would you like me to keep on going? Okay, continue presentation. Okay, keep on going. Okay, awesome. Okay, we will keep on going. So we're going to talk in the next half of the presentation about prevention. So we're going to start discussing suicide prevention and what we can do to help save lives. And your presence here is an indication that that's what prevention is all about. So when we talk about preventing suicide, protective factors are things in a person's lives that make them less likely to take their life and lower their risk. So protective factors can include feeling connected to family and community support. When someone has concerns about their mental health, they may not know how to turn for help. But when that happens, having friends, family, and community reminding us of our strengths can be a tremendous protective factor. Cultural and religious beliefs that encourage connecting and help seeking, discourage suicide behavior, or create a strong sense of purpose. It can also be a protective factor that is helpful in the thoughts of suicide. So social support, cultural cohesion, and the role of immediate and extended family can play a role in reducing the risks of suicide behaviors among African Americans. Families can provide a natural support system, emotional support, and advice during times of emotional stress. Supportive family and social networks increase the likelihood of seeking help from a mental health professional and seeking the treatment, and individuals who attach importance to family and children are less likely to engage in suicidal behaviors. Now, so while family can be a resource, there may be some situations where expectations put on an individual to put an individual needs before their own can hinder help. And some family are just not as supportive. But spirituality, religion, and faith can play roles in coping with mental health. Spirituality can look different for each person. So religion has a prominent role in the Black culture and can be a protective factor and less stigmatized way of asking for help. Many Black people are more receptive and more likely to seek help from religious leaders or healers who are trusted in the community. So it's important to note that in some cases, a religious community can be a stressor when the community does not encourage mental health care or does not support all its members. Some may be less likely to ask for help and feel isolated. But incorporating spirituality into mental health services can aid in expanding suicide prevention in our community. And also, strong racial identity can function as a protective factor. It can provide a sense of belonging and connection to other people. So, another quick activity: what protective factors play a role in your life? And feel free to put them in the chat if you feel so inclined. So take the time and please provide me with just what are some protective factors that you utilize to help you with the stressors of life? How do these things help you through difficult experiences? So what do you do when you're tasked with a stressful situation? What are some of the things that help you cope with life at this time in 2024? Okay, I love that. Prayer with others, exercise. I love therapy, TBG sister circle. Unfortunately, sometimes social media. But so your social media can be actually good in nature if you follow positive people. And I'm not talking about toxic positivity, but there is wonderful ways that you can actually, you could be very uplifted. There's some wonderful influences out there that's about positivity and also learning how to cope with stress because life is full of stress, but it can also be helpful on how to cope with that or talking to others who share my same experience. That's great. Strong peer relationships, regularly meeting with a therapist, meeting with a mentor. That is all wonderful ways to keep mental health and mental strength. Best friend group, supportive partner. I love that. Thank you for all the courage to share. Those are wonderful opportunities to understand how to hope and thrive. Our presentation. All right, so because mental health care is so important in preventing suicide, we're going to focus on this topic for the next few minutes. So getting effective treatment for mental health conditions like depression or anxiety can prevent suicide. Members of the Black community may be uncomfortable with seeking mental health care for various reasons, including stigma. So stigma of having a mental health condition or stigma of seeking for help is a big issue in our community. So we all have a role in addressing the stigma around mental health. There is a need to shift the narrative and stigma around mental health to think of it as equal as physical health. For example, if someone broke their arm, would they feel stigmatized going to ask for help or care? And they would not. So mental health should be thought as the same thing. So seeking help for mental health and wellness can have many benefits for a person and their community. And this slide does a really good job in showing you just how some of the things we can do. So benefits can include less anxiety, greater self-confidence, better relationships, regaining emotional balance, increased assertiveness, stress relief, ability to set boundaries, and trauma resolution. So all of these benefits and more at an individual level have a positive impact on the family and the community. So if a person has mental health concerns, it can make it difficult for them to take care of themselves or others. So seeking mental health care not only benefits the individual, but the entire community. So how do we do that? So we can first start, somebody mentioned in the chat, finding a therapist. So what does it look like to find a cultural competent therapist? So there are going to be several ways that we can provide to you to do that in the Black culture, in the Black community. So first, consider your needs and what's important to you when you're thinking about a therapist or mental health coach. It can be helpful to think about finding a therapist that works like it's like a dating relationship. So sometimes it's the right match, sometimes it's not. This can be due to different factors, including timing, the type of therapy practice, and the connection between the therapist and the person seeking help. So while looking for a new therapist, it can be beneficial to think about different characteristics that help you want to find a therapist. So what is important to you? Is it important that the therapist identifies with the same gender as yourself? Do you prefer to have a Black therapist? So knowing what you want can help you find a therapy relationship that works for you. It is most important that you feel comfortable talking to your therapist and that you trust them. And talking to a new therapist, let them know your concerns and previous experiences with mental health care. And it's okay and common to try a different therapies before finding the right one. So try them on, because remember that therapy is a process. Because therapy is most beneficial when you find a therapist that's right for the individual, it's important to do your research. Finding a therapist can be a difficult process, but it is worthwhile. It is important not to give up if you have to go through a couple of different providers, and remember to ask questions. Well, some questions that may be helpful to ask would be, what experience do you have working with Black and African American communities? Do you have a specific training or life experience that relates to working with Black clients? Have you been trained in anti-racist practices in mental health care? It can also be helpful to specify what you're not looking for. So if you do not want a therapist that isn't Black, feel comfortable in sharing that information. It may take some time for you to find a provider that's right for you. If a provider you want that you need, just continue to looking because they're out there. And now we're going to do a quick activity. So when you think about finding a therapist, we'll start this activity by thinking about your experiences for physical concerns. When you went to the doctor, what things did the doctor do to make your appointment more comfortable? Or what do you wish they could have done? So in the chat, provide me with 3 things you would like to see in a therapist, and they can be the same as what you look for as a doctor or a different aspect. Is the language spoken on is important different to you? What attributes do you think you would need to be more helpful if you needed mental health care? So for those of you who would be considered or actually is in therapy now, what are some of the things you would look for if you had to seek out a medical professional? What's important? Does she have to be a woman? Can she be a man? She has to be Black, but she has to be white. So if you're comfortable in sharing, I would love to know 3 things that you look for in a therapist. I love that. Black woman works within the LGBTQ plus community. I like that. Anything else you would look for if you had to look for a mental health professional? I love having the same experiences with racism. That helps. Being relatable. That's a big thing. So while we're thinking about more, we will go to the next slide and it will tell you how to do that. So we know that it might be difficult to find a Black therapist to support you in your needs. The most recent data from April 2022 says that while 76.4 of therapists in the United States are white, only 4.1 identify as Black or African American. And in the chat, I did see some wonderful resources about therapy. And this is another one too. So there are options, and even a simple Google search may help you find local or non-virtual assistance as well. But on this slide, there's a few examples of places where Black therapists can be found. So you'll find some directories that connect you with agencies and individuals doing this work. Now, just keep in mind, we don't run, recommend, or endorse or fund any of these groups listed. It's just a good starting point and encourage you to find the best fit for you. So, be sure to look at Black Emotion and Mental Health Care Collective. There's a couple of social media handles that you can follow and just see what you're looking for. But this is a good starting point, and inclusive therapists may help you match with therapists that specialize in your community and groups that best fit your unique needs. So this is a good starting point if you're looking to start therapy or just want to help and include and expand your mental health care. And just remember, don't give up. Help is out there. So while mental health care can prevent suicide, we also recognize that barriers in place in the Black community, there are barriers when seeking care. It may be difficult to find a provider that's trained in cultural humility or may be part of the Black community. And due to generations of malpractice with Black patients, the mistrust of the medical profession may make Black people less likely to seek help from the medical community. Black people may feel like their concerns aren't heard by the medical professions or that they aren't provided the care they ask for. They also may be concerns about medication and actually putting you on medication for depression and just all kind of medication. So there's different concerns when we consider making the mental health care a priority for us. It can be difficult, but there's help. So we can look at this slide right here, and these are self-care strategies. Remember the protective factors we discussed earlier in the presentation? In addition to professional mental health care, proactive self-care strategies like good sleep habits, exercise, nutrition, and stress management can also play a critical role in protecting mental health and promoting resilience. So we encourage you to make more time for your own self-care on a regular basis and to connect to activities and people that help you feel supported. So feel free to take a picture of this slide. I think it has great suggestions on what you can do if you don't already incorporate these self-care strategies, and it deals with your mind, body, soul, and surroundings because they're all connected to your mental health care. And May is Mental Health Care Awareness Month. So to address discomfort, fear, or barriers around mental health and suicide, we need to build a culture that encourages seeking mental health care from those who need it. Mental health care, just like physical health care, it should be included. Now, we all have a role in addressing stigma around receiving mental health care. So another brief activity in the chat, we want to encourage people on how to seek mental health care and lower the stigma in our communities. So how can we lower the stigma of people reaching out for help for mental health care? What are some of the things that you can think of that we can think about? So come up with 3 to 5 ways in which you can encourage people to seek mental health care and lower the stigma in your community. So if you had someone in your personal circle that was struggling, what do you think we could actually, what kind of words of encouragement could we use to help them say, it's okay to seek mental health care? Because that's going to help lower the stigma. So is there anything you can think of right away on what we can say or what we can do?
I'm sorry, Chanel. May you repeat that question one more time?
Sure. So with in the chat, can you come up with 3 to 5 ways that we can all encourage people to seek mental health care and lower the risk in our community for stigma? So what are some of the things we can say or help to do to encourage people to seek mental health care? Like if you've got a girlfriend or you've got a boyfriend, if you got somebody in your family that's actually struggling, what can we do? Oh yes, I love tell them about TBG. I love that. So that's a starting point. So a lot of times, especially with Black communities, it's really referral. So, I mean, you have to actually have someone who has done it and it hasn't hurt them. So mentioning that seeking for mental health can help their overall success in jobs, relationships, education. I love that. Mentioning my success in mental health care, yes. Have you thought about mental yes. I'll even share a personal anecdote with you. My sister actually she was working for a company and they encouraged mental health and wellness. And they had this big old session in her group. And I said, oh, it didn't hurt her, it didn't kill her. So I was able to go, but it was because I knew that she went and it helped her tremendously. So often, especially with our community, because of the distrust, if we see somebody in our community go and it helps them, it usually helps to relate. It's okay, it helped them, maybe it can help me. I love to engage in open and educational conversations about mental health, offer the resources. Dr. Raquel Martin on Instagram. I love that. Mental health professionals share your experience talking with mental health. I love that. I think if anything, just sharing your experiences with that person is wonderful. Ask them to meditate with you and using the free videos on YouTube. And we talked about earlier with social media. Social media can be definitely a help. It makes everything a little bit more accessible now. Excellent. Yes. So all of these are wonderful ways to help someone that is in crisis and also help uh, debunk the myth of asking for help. And sometimes that's hard, especially among our community. So thank you for all for the courage to share. So we're going to just talk briefly about some warning signs. Now that we've talked about mental health care in our community, we'll talk about some warning signs for a few brief slides. So suicide warning signs, they're typically displayed in three major ways that we can detect. These are the ones that we see on the slide. So we think about talk, behavior, and mood. So we'll talk more in each detail about them in different slides. And we want to remind you that one of these things on their own might not be a sign that someone is thinking about suicide or thinking about attempting, but we must consider the person and as we see them as healthy and see if they're looking at themselves. So we have to consider all three of these, but one in itself is not so much of a sign. So we'll just talk about them. First sign can be talk. So many people who are suicidal talk about ending their lives either directly or indirectly. So remember that each person is different. Some people may make their intentions known and clear, like talking about they have no reason to live, or that they may feel trapped or burden others. Some people keep it hidden, and in most cases, their comments and behaviors may be subtle and go unnoticed. So, for example, a person may joke about it or only hint about their despair. No matter how a person talks about suicide, it is important to take it seriously if they mention it, especially if they are displaying other warning signs of suicide. So definitely be careful when somebody talks about it. Please be just keep your ears and eyes open about that. Talk is definitely important. All of these things on the slide. Just inquire about it if they say anything. The next behavior is going to be the next thing is going to be behavior. So behaviors are unusual for an individual should they encourage you to speak for suicide if you notice something. So this is where you have to be definitely observant. These warning signs related to a person's behavior, especially if a person or signs are unusual for that person. So if they're doing something that they're not usually used to doing, this is definitely a key. So these are just some things you can look for on the slide. You know, the increased use of alcohol or drugs, trouble sleeping, sleeping too much or sleeping too little. And I was on a workshop and it says sleeping too much would mean they're trying to escape. And sleeping too little, they're worried about a lot of things. So sleep is definitely a big factor. Acting more recklessly, withdrawing from those activities, especially activities they normally enjoy, isolating from social groups such as family and friends and religious communities and other groups, looking for ways to kill themselves, such as searching for things online or methods or shopping for a firearm, or giving away their possessions or showing a related behavior, reckless spending. So these things are more is something you definitely want to look at. So if you combine that talk and behavior, you just want to be mindful of this loved one because they might be in crisis. And the next thing you should be considering and looking for would be people who are at risk. They can display, especially subtly, just any of these moods on the slide. So you think about depression, apathy, humility, humiliation, as well as anxiety. Essentially, these moods must be spent when they're overwhelmed and depressed and desperate. Many people who are suffering, they internalize their pain and desperation. Some people express distress in forms of rage, irritability, and being impulsive. So we all have up and downs in our moods, but the key is to notice changes in unusual patterns, changes that can seem uncharacteristic or concerning. So, for example, if they've struggled with depression for over a long time, changes can signal that mental health symptoms are worsening or that their risk is increasing. Now, another example could be subtle, explained happiness in someone who's been depressed, which can also indicate that the individual has decided on a plan and that they're no longer going to be in pain. So, these are the things you have to really just be mindful for and look for in somebody that might be struggling. So, what can we all do? Now that we've reviewed the key suicide prevention efforts and warning signs, let's talk about what we can do to all prevent suicide. How can we protect our community and ourselves and our family and friends and prevent suicide? So there are three main things we can do to support someone we think that might be at risk for suicide, including watching out for warning signs, reaching out to a person to have a caring and courageous conversation, knowing the resources, and encouraging the person to seek help. So we just talked about the warning signs, and these are the things you have to just consider: person, how they talk, their behavior, and their mood. So just remember, warning signs may be subtle. They can vary from person to person. And this is why we're here. So let's save lives. So it's important to reach out to the person you're concerned about. One way we can think about what to do is to remember the name of this program, which is Let's Saves Lives. Let's is an acronym that stands for key steps that will help you remember what to do when you're concerned that someone may have suicidal thoughts. We'll talk each of these about most of these in each slide, but just think about Let's: listening, empathy, trust, and support. So before covering the steps on what to do, here are just a few reminders about what to avoid. So you don't want to minimize or invalidate their feelings, trying to convince them that life is worth living. If a person is nearing a crisis point, they are not thinking clearly, and debates about life being worth living tend to not be helpful. Offering advice on how to fix it. If a person is having a heart attack, you wouldn't tell them to start exercising or eating a healthy diet. Well, the same is true for someone who's in a mental distress or crisis. But there are some things and helpful reminders you can do when you're reaching out. You can talk to the person in private and allow them to share what they're experiencing by listening to their story. You can express concern and care. A person with an extra dose of active listening is a way to show your care and allows you to gain more information about their level of distress. You can ask directly about suicidal thoughts. Now, while some people worry that asking about suicide will increase suicide risk, research suggests that just having a conversation about suicide with someone that you're worried about can help decrease the suicide risk. And you want to encourage a person to connect with available resources or mental health services. If they are in crisis, what they need is to be heard and connected with help. So our LETS acronym, the L means listening. So if you notice warning signs in someone you care about, it's important to reach out, ask about mental health, physical health, and suicide because it all matters. So examples of starting the conversation here on the slide, you don't seem like yourself. Is someone, is everything okay? Are you good? And just think about some ways in which you can reach out and how you can be intentional. But the main thing is going to be listening. So let's look at this slide and we have to listen. So ask if they're experiencing any stressors or concerns. Ask about a main stressor that you're aware of and that they've shared with you previously. Ask about how the stressor is impacting them. And ask if they've thought about ending their life. And it's important to ask if they thought about ending it. You have to use the word suicide, ask in their life, because if you bring it up, it will most likely be grateful that you did, but it shows that you care and that you are impactful. So it's important to have a strong, caring, supportive conversation with someone you might be worried about to allow them to share what they're experiencing. A conversation is a way to show you care. And just think about this slide when you're thinking about reaching out to someone who you might consider or might know that is in crisis. The E stands for empathy and support. So care and compassion, express care and compassion for what you've seen. Go back to the behaviors that you observed that we talked about on this slide and definitely address them gently. And you show your support by offering the support, resources, and ways that you can help. So this just provides a starting point. And remember that when asking about suicide, just be genuine with the person that you're speaking with is the key. The key is you just being there and holding a space for them. And we want you to trust your instincts. Assume that you're going to be the only one reaching out. To protect our community and loved ones from suicide, we have to look for those changes in behavior and trust our instincts. We might be the only person to reach out. So if you know someone is depressed, anxious, or having warning signs of suicide, just show you care and check in on them. And even if suicide turns out not to be the concern, they may be having a hard time and they may feel comforted and supported just knowing that you care and you're taking the time to listen. And I would just share, I was at a holiday party last year and we were talking about mental health, stress, and crisis. And I remember a young man saying that he had lost a couple people. People were actually experiencing stress, and I was able to provide some resources right then and there. So, if anything, just having a conversation is just showing that you care. And other things you can do if you're concerned that someone you live with is thinking of suicide and that you should be aware that you can make your home safer. So for family members who are thinking of suicide and may act on those thoughts, you can make your home safer by taking the steps that you see on the screen to limit access to the ways they can try to kill themselves. So you could start by removing scarves, belts, and cords for easy access, lock up knives and medication, secure firearms. Ideally, firearms should be temporarily removed from the home. Have the conversation about the firearms. They could be a touchy situation, but you're showing that you care, that you're actually bringing it up. If that's not possible, firearms should be locked in a safe away from the person that you're concerned with. And the ammunition should be locked away and stored separately. So these are just some of the things that you can do to make sure that the residence is safe if you have somebody that's struggling. So it may be difficult to imagine, but there may be a time when someone you care about is sincerely thinking about suicide and say they have a plan. So in these situations, you can help them by staying with them until they obtain help. They want to die and have a way to kill themselves, do not leave them alone. But if you're unable to stay with them and they are not a risk to you or yourself, call another family member or friend to help assist. But if the situation puts your own or your others at risk, leave the area immediately and call 911. If available in your area, try to contact a mobile crisis unit or a local mental health service for assistance. Try to get them to an urgent care or emergency room for immediate mental services. Help them make their home safe and remove access to things that they can use to kill themselves. Okay, so if it's a medical emergency, such as a suicide attempt in progress, call 911. Now, we acknowledge while 911 can be a lifesaver, it may not be the best or safest choice if you don't want the police to respond. We understand that this is an extremely difficult situation to be in, so learn about hotlines, available crisis care, or other safe options is going to be the key. Alternatives to 911 include the mobile crisis response team. This service provides same day intervention to people experiencing mental health crisis in the community. Calls are responded to on site, so this could be at home, work, or school, by licensed mental health professionals with the goal of preventing a crisis from becoming an emergency and referring the client to mental health services. If nothing else, research the practices at your local emergency rooms or urgent cares. So we acknowledge that there is an increased risk of death for people of color experiencing a mental health crisis when 911 is involved. So while calling 911, provide as much detail about the nature of the situation as possible. Even though you may convey a lot of information to the dispatch, it may not get passed on to the police officer. So please be prepared to re-explain without assuming that they have that information on hand. Now, this would be a great time to take out your phones and take a picture of the slide or add these crisis call and text lines as contacts. Even if you never use these resources yourself, you may need them to help a friend. They're open 24 hours a day, 7 days a week, 365 days. So 988, when you call them, you first hear a greeting while the call is being routed to a local Lifeline Network Crisis Center. It's based on a caller's area code. A trained crisis counselor answers the phone, listens to the caller, and understands how the problem is affecting them, provides support, and takes resources if needed. Local crisis center is unable to take the call. The caller is automatically routed to a national backup calling center. And this lifeline provides services in both English and Spanish, and also services are available in over 250 languages. When you have the crisis text line, the text can start with the opening message of talk for Spanish, and there's a Spanish language for the texters for a greeting. The texters are usually greeted with two friendly automatic responses, and within 5 minutes, you're connected to a crisis counselor. So these are just some resources and more that can help. And we have the Trevor Project, the LGBTQ plus community with the youth. There's a trans line. There's also an elder line. So there's lots of resources out there. So please take a picture of this slide and also do a Google search for other resources. But there are tons of resources out there for mental health and wellness. And as a just an add to this AFSP, American Foundation for Suicide Prevention, I am a volunteer there. You can go and check on the website. They have tons of resources from a local standpoint, from a state standpoint, from a national standpoint. But we have a lot of resources here for Georgia if you need them. And we can create a culture that's smart about mental health and suicide prevention. So that's what this presentation was all about, sharing the resources, sharing the slides, and just me being a wonderful guest here. And I definitely appreciate the invite and just being able to present this information. And these are just some other ways that you can actually, this is related to AFSP, the Georgia chapter. So we have a lot of events and the ways you can become involved. You can become an advocate. You can train to be a volunteer presenter like I am. There's walks. You can sponsor events, give a gifts. We have a lots of resources to help with anybody that's dealing with any aspects of suicide. So if you're struggling with the thoughts, if you lost someone, if you had attempts, we have different ways. So this particular conversation or workshop is specifically for African Americans, Blacks, but we have LGBTQ plus, we have the older adults. So just please check out our website if you want to know more resources that we have to help. And there is a feedback QR code that I will give you that you can use. We want to have some feedback to see how this presentation is actually being received. This was a pilot program that started last year. So we're trying to get it into many, especially Black and African American communities. So I will actually just have you just zoom on this and just give us some feedback about the program because we're trying to take it all over the place to make sure that we have access to this. So it's definitely important for us. So if you would be so kind to either zoom in on the QR code or better yet, do the afsp.org the Let's survey, and I would definitely appreciate that. And we are all on social media. We have a Facebook page, a Twitter page, uh, YouTube channel, Instagram. So please follow us for additional resources that we show up every day on there, something to help. And I want to thank you for all of your time. And I will go back to that slide for the survey. I tried to get it done as fast as I could. So if you had any questions, we have 15 minutes for Q&A.
Chanel, thank you so much. I learned and I feel so much more comfortable addressing topics that you already know within the Black and African American community. A lot of families shy away from it. Definitely not all, but a lot of families, and I can say my family did. We discussed this. So my number one question is, what when someone is just distressed and you want to show up for them, what if they shy away from you? What if they begin to ignore your calls or block you? How do you help them in that area? You want to show up for them, but they're just not open to the help.
Well, what I can just say is that the fact that you reached out to them shows that you care. So if anything, you're just planting the seed. So they might not be ready to receive the resources right then and there, but they know that you're a resource. So when they're ready, they will reach out to you. But it's wonderful that they say, okay, Aisha's actually in my corner. So I think just even just expressing concern, that's the first step. That's even with this presentation, everybody being here just to figure out what they can do. It's just something that you're there and they know they can come to you. That they know you put them on the radar so they know in the back of your mind. So when they feel comfortable, they can reach out to
Okay, that makes sense. Thank you for that.
you. Anybody else have any questions that they would like to ask or just anything that you have a question for? Like I said, it's really like I said, I didn't know until I started even presenting this presentation that we were having such a hard time in our community, especially with our youth. And I say youth, I'll say under the age of 30. So we think about some high profile losses of suicide. We think about Regina Halls, her son, he was 26, she lost him. The beautiful sister, USA, today, she was 30. Um, we're just losing people just for multiple things. That's why if you can keep them on the radar, that would be helpful. I even came into this work when I was in the 7th grade. I remember a teacher on the bus that told us we lost a classmate to suicide. That was in the 7th grade for me. I remember reading Essence magazine and reading about the beautiful Phyllis Hyman. I didn't even know suicide was even an issue in the Black community because we don't do that. We're strong enough. So it's just we're not as strong as we think. If we mental health, it could be multiple stressors, and we do know, being African American, Black in this community, and just in this world, those are stressors, and you add them home stuff, and it's just how do you cope? Can you cope? And that's what this presentation is about: just providing different ways to cope with life stressors.
Thankfully. We have a question. How do we address patients that are struggling? Um,
Mhm.
yeah, I hope I'm pronouncing your name correctly. Cherie's in nursing school. Do you have any suggestions? She says, how do I approach a patient about this? Is it the same for a loved one?
Patience. Well, what I can do, I know I love that slide about self. I guess it depends upon how they feel about health, reaching out. Again, we still have those scary depends upon how people feel about reaching out. What does help look like to them? So I would ask them, what does help look like? Because it could be not only medical help, but it could also be self-help too. How how are they struggling? It depends because a lot of people don't want to reach out immediately for mental health because they could have some stigmas about that, or they could have somebody who went and it didn't work out well. I follow a blog, and some people are concerned about being admitted to the psych ward and the finances and the bills that are with that. And now my family knows. So I would ask the patient if they're struggling, what does help look like to them? Do they want mental health from a professional right away? Or is some things that they can do to like these self-care strategies I have here on screen? If you could maybe give them this or have them to say, hey, look up self-care, healthcare mechanisms. I mean, there's a lot of things that you could do as a person to be able to put in your toolkit in order to feel comforted if you're dealing with mental distress, if they're not ready for mental health care. Because mental health care also costs money too. If you don't have insurance, that's an issue. So even getting help can be stressful. So what does help look like? Do you have the funds? But if you have the funds, most companies do provide the EAPA. So there's a lot of things. It's just what do you have in your wheelhouse right now to be able to self-soothe? That's what I would say if you have people that are struggling, ask them what kind of help looks like, and then you can go from there. It's going to be individualized care.
This was so helpful. But yeah, that's the first thing I thought of was the facility bills. You
Yeah.
know, I'm always mindful of people, like, just in general, if I'm helping someone, I'm like, oh my God, but they have insurance or they don't have insurance. Do they want to pay this? But I'm just gonna have to take my mind out of it. The whole goal is to help. That's how some of y'all know I overthink. All right. I'm just
Well,
checking
no,
it.
it's good though because, like I said, yes, you want to help, but then they're thinking about once they're if they have to be admitted to their facility, what do the bills look like afterwards? I mean, so that's why a lot of people don't ask for help because they don't. It's a whole process with this. Like I said, what does help look like? Open Path is a great resource. Okay, for finding. Oh, I love that. For that's wonderful. Open Path is a great resource for finding affordability therapy options, but even without the source, that's just wonderful. Yeah, so us pulling together our resources, that's helping too. I mean, just what do you know? What kind of things? Because we're good in our community of being able to provide some resources. I mean, we can come together. That's what we had to do before we even had these, before social services. We band together to come up with resources to help one another. That's what it's all about.
All right. Does anyone else have any other questions?
And I guess now you said I can ask you, what are you seeing out there in the mental health space? I mean, are we getting better with the coping mechanism? Are we reaching out for help or we're still reluctant?
Thank you for asking. So specifically, I'm within the Sister Circle with Therapy for Black Girls. And when you surround yourself with people who are on the same mental health path as you improve even more. Before I was a team member on the Therapy for Black Girls team, I was just in the Sister Circle with women who want to improve. So that really helped. And you mentioned that, like, just being around the people, surrounding yourself with people who actually love to improve themselves or just seeking help. So that definitely has helped. And that's the main resource I have now. So since I'm now a part of Therapy for Black Girls teams, it's been 3 years. I'm thankful to say that I'm a plethora of resources, from the podcast, from tips from Dr. Joy. Of course, for Black women, I refer them to the Sister Circle. Some join, some do not. It's perfectly fine. But I'm always there. As you mentioned, Chanel, if people know that they need help, a lot of them do come to me. So I'm grateful to share. I'm very am.
And that's wonderful. And that's what it is sharing too. Like I said, because I've been in this space, I just gently tell people I'm in space. And I remember having lunch with a friend, and she told me that her son was struggling. So I had the AFSP resource cards, and I'm giving her this, and I'm specific stuff for Black men because there's stuff for Black men and Black women. So two, you have to, again, let's go back to what does help look like for you, and does it matter where it comes from, or does it matter? Sometimes it does matter. If you have had obstacles with the opposite sex, but you don't want to go to that person for help. So this is why we have to ask, what does help look like for you? Because it's going to look different for you than it does for me. So yes, but I have all the stuff in my car in my wallet. So AFSP has life-saving guides for the general population, for the LGBTQ plus community, also for older adults. So I think they're working on an African American one, therapy for Black adults. That's what this presentation is about. What resources are culturally competent for this community? Because it's different.
It is different. And something I just put in the chat, and I learned this specifically with a loved one. I was sharing too much information. And they said, thank you, but this is a little bit too much right now. And I have to acknowledge that because I'm so excited to share the resources because I didn't have these resources years ago. And once I acknowledge that, I'm like, okay, Naisha. And then I'm like, are you open to resources? I have to just make sure, I help in the way that they want to provide the help, as long as I know that they're not in danger.
I love that because, like I said, when we're in this space, we already got them in therapy. They finished, and we said, wait, I was just asking a question. So I think I have to be careful too. I've already set up with the person. It's like, well, wait a minute, I was just asking a question. So
Absolutely.
yes, what
Thank you.
kind of help do you need?
Yeah, I have gotten better, but before I was like, just throwing it out there. So I've gotten better. So I think it looks like no one else have questions, but we all enjoyed their presentation. I definitely saw that in the chat, and I'm going to put the URL for the survey. Let's definitely pump up Chanel. She gives a wonderful presentation. I'm going to put that in the survey, and for everyone watching the recording, if you could just scan that QR code, or you can email me because my email is on the I sent you all the recording. Email me and I can give you that QR code as well. All right, so we are going to end. Everyone will receive the recording. The resources were there. If you didn't get a chance to take a picture, the resources are at the end of the presentation. Chanel, thank you again. We appreciate you.
And thank you so much for having me. And thank you for everybody being here. You're part of the process of making sure our community stays safe. So thank you, everyone.
All right, bye.
Bye.
Bye. Thank you.
Thank you.